Hello, how are you? I'm Dr. Irma. Very nice to meet you. And welcome to the sleep study. Yes. Is this your first time? Okay. So let me just explain the procedure to you so you know exactly what we have planned for this evening. I have an extremely comprehensive cranial nerve exam that I'm going to be performing. But for the experiment, I'm going to have you extremely relaxed. I'm going to be bringing your brainwave down into theta waves. What that means is you're going to be at a twilight state just before falling asleep. That state. And then I'm going to conduct all of these exams while you are in this twilight state. And I will be measuring with a very smart device your brain waves as part of the experiment. How does that sound? Alright, let me get you all set up and hooked up. Alright, so I'm going to place this very comfortable cap on you. It allows me to paste little electrode stickers all throughout various regions of the brain so I can get a nice reading of where you're at throughout the exam. So you just hold your head nice and still, and I'm just placing that nice and snug over your head. That's perfect. Just let that rest on your head. I'm going to take these stickers and just tape a few of them on a few regions of the brain. So the first one goes right along the prefrontal cortex. Definitely want to get a reading of that. The second one goes right along the Broca's area and the Wernicke language centers of the brain. That goes right along here. And I'm going to place a sticker right near the amygdala just to scan the emotion centers as well. And one more sticker for the cerebellum, just to check your balance right back here, the base. That's perfect. Let me get my keyboard so I can start to record a session. And right now, you are in beta brainwaves, and all that means is that you're processing information. But I'm going to get you nicely relaxed into theta brainwaves. Excellent. Wonderful. Let's go ahead and begin. I'm gonna now examine the muscles on your neck, muscles along your jawline. These muscles here, the sternocleidomastoid muscles, all the way up to the mandibular, all the way up here to your jaw. I like for you to just relax your jaw, let it just feel a little slight hinge opening. Like that is perfect. I'm just checking cranial nerves that run along the face, especially the jaw. Very good. And your neck. Let yourself have some space along your neck. Just like that. I'm going to turn your head this way towards your right. That's perfect. I want to get a better view of your left sternocleidomastoid muscle all the way down from the base of the ear down to your shoulder, right into the levator scapula. A little tender here, but that is absolutely normal. Taking a hold of your head, moving you towards your left shoulder. Just look straight ahead that way. Checking the sternocleidomastoid on your right side. From the base of your ear down to the levator scapula, right underneath the trapezius muscle. Very good. And I'm gonna just bring you back to center. Excellent. I'm gonna now check your suboccipital muscles right at the base of your skull. Placing my hands behind you, the back of your neck, and very soft presses on those suboccipital muscles. Very good. Checking for any atrophy. Your neck seems very strong, which is good. I'm gonna have you just lift your shoulders towards your ears. Nice lift up. Very good. It's a very pleasant stretch. Feel that. It feels wonderful. And go ahead and drop it down. Checking your coordination, which is very important for cranial nerves. That's right. I'm going to just guide you for this part. Raising your arms up at your side. Very good. Now I'm going to just very gently press down, and you're going to resist. Very good. Some counter pressure, checking for your motor skills as well as your cranial nerves running along your arms. Very good. One more time. Pressing down. Don't let me press down. Very good. That's excellent. You are doing great. I'm going to just check your eyebrows. And what I need for you to do is lift those eyebrows up as high as they can go. Very good. Now bring them back down and relax your face. Now I'm going to just hold your eyebrows in this position, and you're going to resist the press. Lift your eyebrows up, up, up. Don't let me hold them. Very good. And that is perfect. Checking your face. I like for you to just make a smile. Very good. Hold that smile for a moment. Checking cranial nerves along your face. And you can just let that go. Back to neutral, relaxed face. Excellent. Very good. Now, I'm going to check your shoulder girdle. I like for you to just imagine the perimeter around your entire shoulder girdle is a diamond-shaped bowl, and I want you to just be sure the bowl does not spill forward and does not spill backwards. Just keep your shoulder very balanced. Can you try that? Very good. Keeping your shoulders very neutral, very strong. Checking your muscles along your trapezius all the way to your delts. I'm going to check your rhomboids. They're right back up here on your back, starting on the left. Keep that neutral shoulder nice and perfect. Very good. Very gentle press right on the rotator cuff. Feel that very tender little muscle. Excellent. Let's check your rhomboid on your right side. Placing my hand behind you, right on your upper back. And just breathe normally. Checking your rotator cuff. Right here on this tender shoulder blade. Very good. Your muscles and your motor ability are functioning 100%. which is perfect. That's what we want. Very good. I'm gonna use this little massage tool. It comes in this handy little bag. And this little tool slides very gently and meticulously across all of those tender areas. I'm gonna do this just to help bring you back into your body so you can be present for all the exams. Starting with your left shoulder. I'm just gliding this instrument across. It does a very wonderful job of ironing out any muscle knots. It's really lovely. Allow yourself to feel all the tension from your left shoulder releasing and dropping. Any heaviness there. That's perfect. Ironing out your deltoid, front deltoid, and the rear deltoid. Feel this wonderful ironing out of any crinkly muscles right across all those tender shoulder areas. Feel those muscle fibers straightening out. Very good. I'm going to take a hold of your arm. Taking a hold of your left arm, I'm going to draw a line from the top of your shoulder down your left arm. I want you to really let go of this arm from your delts down your tricep, passing the elbows and down your sleeves to your wrists. Relax your hands and just let them hang heavy right at your side. That's wonderful. It's one of my favorite tools. Let's iron out your right side, shall we? Yes. Starting with the elevated scapula on your right shoulder. Small, deliberate circles all the way across your collarbone and back to your deltoid. Feel all of those muscle fibers getting ironed out. No more knots on this right shoulder. It's nice and renewed. Taking a hold of this right arm and supporting you. I'm going to draw a line just gonna give you lots of relief. Feel your right deltoid down your bicep and hooking around to the triceps, drawing a line past the elbow, through the forearm to the wrist. Very good. Let go of your hand and just keep it at your side, nice and relaxed. Wonderful. Good job. Now checking your near vision. I'm going to hold this eye chart up for you. I'd like for you to just read this line over here. Correct. That's right. Wonderful. I'm going to hold the eye chart further back just to get your far vision. That's right. I'm just going to hold this right up here just to get a baseline of your vision. Can you see this line over here? Right. That is correct. Well done. Very good. Let me get your trial lens glasses now. And now for your vision test. I'm going to try different lenses on you. I have some concave lenses, some that are convex, and some that are more neutral. I'm going to place these trial lens glasses on you, and I'm going to check your vision, your near and far vision, using lens 1 and lens 2, and also checking with or without lens 2. Sounds good? Okay. Let me get you set up for that. Right away. You just have these nicely adjusted so they fit your face just right. Just hold still for a moment. There we go. And that's nice and steady on your face. Wonderful. So I'm going to grab you 2 lenses. Here is a lens 1. Let me know if lens 2 makes it better or blurrier. This is with lens 2. That is without. This is with. One more time. Without. And with lens 2. Stepping back to give you a chance. Just see if you can read this line over here. Right. Can you read this line over here? That is perfect. You got it. Let's try these two lenses. Here is lens 1. Stepping over to your right side. Take a look at the eye chart and keep your eye on the letter E as I switch to lens 2. And over on your left side. Let's go ahead and try lens 1. Or do you prefer a lens 2? Of course, can you see this line over here? Very good. I will make a note of that. Alright. We're getting very, very close to your prescription. I want to try this lens 1. Stepping to your left side. Take a look at the eye chart. Let me switch to lens 2. Over to your right side. Back to lens 1. So you can compare. See which one is clear. Here's lens 2. Of course, taking a look at your eye chart here. Can you read this line down here? Let's try your best. Yes, well done. I want you to try reading the eye chart with the lens 1. Can you see this line down here? It's okay if you can't. Can you read this line? That's correct. Yes, we've got it. We have your prescription. Let's go ahead and remove these glasses. And there we go. I'm going to send you a copy of your new prescription so you can have that information. You can get new glasses. Of course. Now for your visual acuity test. I'm going to be checking your eye tracking ability. Just hold your head nice and straight. Very good, and keep your chin neutral. That is perfect. I want you to just use your eyes to track this light. Use your eyeballs to move with the light. Very good. Wonderful job. That's perfect. I'm going to step back. I'd like for you to track the light from a distance. Go ahead and track the light. That's perfect. Moving in closer. I'm going to cover one eye for you. And I'd like for you to just look straight ahead, right at my ear over here. Just watch my ear. Checking your pupil response. That's perfect. Let's do the same on the other side. Covering your eye. Look straight ahead, right here in my ear. Very good. And that's perfect. Now I'm just going to go bilateral testing. So all you have to do is keep your eye looking forward. Try not to blink your eyes. Beginning now. That's perfect. Your cornea looks good. And your eyes reflex time is perfect. Let's go ahead and test your ears. I want you to just hear the sound on your left ear. And just track it to the right ear. Very good. From your sound as it travels to your other ear. That's perfect, yes. Let me just get an otoscope so I can get a better look in your ears. There we go. I'm gonna take a look in your right ear, and I'm just looking for all the little hairs in the ears, the little folliculas. I want to check to make sure they're healthy, as well as take a look at your eardrums. So in your right ear first, just softly turn your head this way. Thank you. So I can get a better look in your ear. Wonderful. Let me just turn your head and just look that way. I'm going to check your left ear now and make sure everything's nice and healthy there. Wonderful. Bringing your head back to center. Right there is fine. Excellent. And now I'm going to conduct a very simple cognitive exam. All you have to do, take your time and just find the word be first. Be. That's right. Right over here is the first word. Be. Can you find the word dig? Right over here, going down the word dig. Can you find the word find? And that is correct. Sharing that letter E, the word find. Can you find the word zone? That is right. Zone. Perfect. Excellent job. Very good. I'm going to conduct a color test. What I'm going to do is just hold the sheet of color in front of you, and you let me know what color you see. Yeah? Here's the first one. What color is this? And that's correct. Very good. And what color do you see now? Blue. What color do you see? Lavender, purple. Very good. Which color do you see? Green is correct. Very good. What color do you see? That's correct. Yes. Anything along that range of color is right. Very good. Wonderful. Very important for cranial nerves to check your sense of smell. I have 2 little vials. You let me know what this smells like. Take a nice, deep, refreshing breath. Inhale. Rosemary is correct. Smells like fresh rosemary. You let me know what this one smells like. Take a nice deep, refreshing breath. Inhale. What does that smell like? Fresh basil. That's right. Very lovely smell. Very good. Very good. I'm going to check your heart rate. Placing this right over your shirt. I like for you to take a nice, deep, expansive breath. Feel your rib cage expanding with every breath. Very good. Take a nice deep breath in to your heart. Breathe. Exhale. One more breath from the heart. Breathe in. And exhale. Excellent. Your heart rate is perfect. Let me take my final notes for everything. Okay. Just reviewing all of your notes. I'm just gonna take a few more so I don't forget all the things that we did today. The facial symmetry expression assessment. That's right. The motor function muscular strength. I did that one in the beginning. I did a very comprehensive eye examination, and I will definitely send you all the information you need for your new glasses. I'm going to recommend some eye drops, just artificial tears, yeah, only for the winter months. You're going to want to be sure that your eyes are nice and hydrated. I did a vision, lens 1 and lens 2 test, cognition function, heart rate is good, cervical lymph node palpation. That's when I was checking your shoulders. Hearing test and otoscope as well. So I'm going to